Hello, my name's Andrew, and I'm a student physical therapist.
Hello, my name is Adam. I'm also a student physical therapist, and we're going to be here tonight discussing a little bit about interprofessional communication in a hospital setting. So, Andrew, I know we both watched that video earlier tonight. So, what did you think contributed to the overall flow of that conversation being smooth and effective?
I think, first of all, having the physician lead the conversation and direct the flow, and having everybody introduce themselves prior to actually getting into the details and making sure that everyone was familiar with who was from what profession and things like that. Um, I think the physician was able to share the responsibility well between the different professions and kind of let
Mhm.
everybody um, say what they were in charge of in terms of the patient care
Yeah, I
and that
agree.
that like relationship centered approach. And I think there was also a clear distinction between the different roles that each discipline had, and people figuring out who was in charge of what, like I said, and some overlap as well.
Yes, I agree. I think that they did a great job of making sure that everyone's role was very clear and that there was a clear leader. I think that definitely helped.
Absolutely. So going off your question, how do you think that the team could have communicated better during the meeting? Like, what improvements do you think they could have made?
Thank you. That's a great question. I thought overall they did a pretty good job of communicating, but I did notice at the beginning they were interrupting each other a little bit and maybe speaking over each other. And I just think that it would have been important for each person to have the time and the space that they need to share their thoughts and just everyone showing a little bit more of mutual respect to each other, and I think that would have led to a little bit more of a clear communication between the team.
Absolutely. And I know the physical therapist kind of came off as she was definitely the loudest one during the conversation and almost came off as the alpha. And I think a lot of that had to do with being so frightened that the physician thought the patient needed to be discharged right now when she thought that patient was weeks away and was very concerned for her safety, but that could have
Absolutely.
been treated a different way and maybe a bit calmer than it was.
Yes. And
Yeah.
so how do you think they all work together to kind of, determine what that outcome was going to be? Because I know you said the physician thought that maybe she should be outcome and the PT thought different. So how did they all work together to figure that out?
Yeah, so kind of like I was saying, I think they were able to use a relationship centered approach very well. That included a piece of each discipline in order to have an impact on the patient's outcome and overall safety during when they thought the discharge should be. Um, and as well, I think before the meeting, they all kind of had their idea of what they thought and was going to happen to the patient for their future. And having that meeting helped them sort of make important decisions based off of each other. Kind of like the example we were using, that patient would have had a much different outcome had the physician been in charge of discharge without hearing from not just PT but OT as well about the parents not having the right support for their daughter and different home environments potentially and things like that.
Yes. Yes, absolutely. I definitely think that each discipline contributing their knowledge of expertise was super helpful, and I agree with everything that you said.
Yeah, absolutely. So as student physical therapists, you and I both kind of understand the perspective of the PT. So we can dive in a bit further with specific PT related communication and how we are able to build better discharge plans and prognosis and things of that nature based off of talking to different professions. So first I'll lead off with, why do you think there was such a great disparity between when the physician thought the patient should be discharged and when the PTs and OT thought? And how can we relay that and better inform physicians without these weekly conferences?
Yeah, well, I definitely think that the PTs spend more time with the patients. We have a lot more face-to-face time, so I think that gives us a better understanding of what the patient is actually going through, where the physician isn't always seeing them on a regular basis. So I think that makes it a little bit more challenging for them to know the exact condition of the patient on a day-to-day basis. And moving forward, I think that we can really work on this by communicating more directly with the doctors on a more consistent basis and just trying to keep them updated more regularly. Um,
Yeah, absolutely.
yeah, so what did you notice about the role of the case manager and how they helped with the physical therapist?
Just knowing whether the parents are together, divorced, living in two separate houses. I mean, they're in charge of where medical equipment's being sent, and the PT needs to know what certain obstacles each house has because they could be completely separate from another house and what a PT is preparing the patient for in terms of return to home and ambulation within the house, transfers, ADLs, all sorts of things of that nature. So that's very important. And they can also case managers can also authorize that extended hospital stay that this patient in particular needed. And Adam, I'll follow up real quickly with one last question. So, what effect do you think the psychologist had on the patient's well-being as a non-medical personnel?
Yes, that's a great question. Well, I think that the psychologist has the ability to kind of go into the room and not have to perform as many specific examinations. So they get an idea really into the personal life of the patient on a different level than the physical therapists.